Welcome to today's COVID-19. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. Let's go straight into our COVID-19 vaccine education segment. So the first question we have, can a person take the COVID-19 vaccine during the same time that they may be taking another vaccine for another health concern?
I think if you want to get the COVID-19 vaccine, and you're scheduled to have some other vaccine, then you have to decide which one you're going to be taking, because anytime you take a vaccine, there is the possibility of getting some side effects, some reaction, and those reactions can be two types. One that is very common, where you might have a little irritation of the skin, you might get a little bit fever, a little bit aches and pains to the site, a little redness. These are what I would want to say normal reaction that people might have when they get a vaccine. And then you have another category which are quite rare, and that's called adverse reactions. They're rare, but when they occur, they can be serious, and therefore we need to monitor for them. So if you take two vaccines at the same time, we wouldn't know whether or not one is due to which one is causing which reaction. So it would definitely be preferred that you don't get two vaccines at the same time, so that these side effects can be properly observed and attributed to whichever vaccine that you're taking.
All right. Would this also affect the treatment? As you mentioned that in terms of the reaction might be a little difficult.
Well, my advice would be don't take them at the same time, so you don't have to have those challenges.
All right. Could you explain to us, well, as I said, we had discussed this before, but just as a refresher, what is meant by herd immunity and what percentage of the population would need to take it for us to achieve that with regards to COVID?
Well, herd immunity is really the amount of persons in a given population that is immune against a particular disease. So some people call it herd immunity, others might say it's population immunity. In our context, this word has been used a lot, especially with COVID being around, and people have been talking about us trying to reach herd immunity. And you can achieve herd immunity in two ways. One, the persons who were infected with the SARS-CoV-2 virus and survive would achieve some level of immunity in their body. And therefore, if they encounter the virus again, their body would react and produce antibodies to defend that person. So that's one way that you can get persons in a given population can get immunity. But that also would result in us losing many people getting sick, and some people would lose their life. So that's not a recommended way of getting immunity. What is recommended is that you can get a vaccine, and the vaccine would give you the protection that you need by helping your body to produce the antibodies that you need to fight off the infection without you getting the disease. And that is what is important. And so we believe that we can achieve herd immunity in Guyana by giving the adult population the vaccines. Now, at what level do we need to, how many persons do we need to immunize in our population? That really depends on the types of vaccines that we're using and so forth. But many of the experts have thought that we probably would have to immunize maybe somewhere between 70 to 90% of our adult population to be able to achieve herd immunity.
All right, thank you, sir. I have some questions from the Guyana Chronicle. They're asking for an update on the Linden Dialysis Center.
So the Linden Dialysis Center, we have set aside space at the Linden Hospital We have two dialysis machine there. We have the water system and everything has been installed. We have trained a number of persons to be able to run the service. And right now we are concluding some discussions with 5G, the dialysis provider, so that they would be able to manage the service. So those details are being worked out, and once we have concluded those arrangements, then we will open the center for the use by the public.
Okay. From the Ghana Chronicle again, they're asking if you can provide an update on the COVID-19 variant in Ghana, and if these variants in Ghana, if they're in Ghana, how could the health response change or adapt?
Well, I think the question is making an assumption that there are variants in Guyana. We don't know that, and the reason why we don't know that because we haven't been able to do the gene sequencing. To understand what variants are circulating, you would have to do gene sequencing. We have sent 10 samples to CARFA in January for them to assist us with sequencing those samples so that we can determine whether any of those samples deviate from the norm. So far, we haven't received back the results, so we are not sure if there are any variants circulating here. As you would also know that there are three major variants in the recent times that people are concerned with, and that's a variant that was first discovered in the United Kingdom. That variant, according to the World Health Organization, as of last Thursday, is circulating in 80 countries. You have another variant that was first discovered in South Africa, and that variant is circulating in more than 40 different countries. And in neighboring Brazil, there is another variant that has been discovered, and that one is circulating in about 10 different countries. But the only way you can accurately determine whether it fits into one of these categories or it is something totally new is if you do gene sequencing. And as I said, we have sent some samples to CARFA and we are awaiting those results. So as of now, we cannot conclusively say that we have one variant or another. So that's where it is right now until we get back those results.
Okay, sir. From the Guyana Chronicle as well, they're asking how are discussions with India progressing on securing vaccines from them? And they follow up to that, are we in talks about purchasing vaccines from them or any other country right now?
Well, as I've said before, we are looking at various options to acquire vaccines for Guyana. The first one that we start working with was the COVAX facility. And through COVAX, they have assured us that we are going to get vaccines for 20% of our population. We are also part of a CARICOM African Union initiative, and they have allocated 149,000 doses to Guyana. Those discussions have not been concluded as yet. They're still ongoing, and that's going to continue. We'll see how that progresses. But we have indicated an interest to the African Union that we would want to participate in this arrangement. In addition to that, there are other manufacturers of vaccine, which includes India, and we have had some bilateral discussions with them. They require some documentation. Those documentation have been sent, and we are now awaiting a formal response from the government of India pertaining to the documents that we have sent. So once we get that, we'll be able to say definitively what the arrangements would be with India. In addition to that, we are also talking to Russia and the manufacturer of the Sputnik V vaccine. And again, those discussions are ongoing. And once we conclude them, we'll let the public know. We have also received um, the, from the Chinese that they would be donating 20,000 doses of the Sinopharm vaccines to us. And those arrangements are now being put in place so that we can receive that donation sometime in March. And we have had several discussions with a number of companies that are manufacturing vaccines, and those discussions are ongoing. So when we conclude those discussions, we would then disclose that to the public.
Okay, I have a few more questions, but in the essence of time, I'll just ask one last one from the Guyana Chronicle today. They're asking for an update from COVAX as to when we can expect the first set of vaccines.
So with COVAX, we have sent in all the documentation that they require, and we are awaiting a response from them. But one of the vaccines that COVAX is going to use is the AstraZeneca vaccine. Yesterday, the expert group reviewing the vaccine met, and they have given a green light to AstraZeneca's vaccine. So we expect that the World Health Organization would also, at some point during this month, authorize the use of the AstraZeneca vaccine. When that happens, then COVAX would probably reach out to all the countries who are participating to make the arrangements for the delivery of the AstraZeneca vaccine. But as of now, they had to get through some regulatory hurdles, and so they're right now working on those hurdles, so to speak. Well, not hurdles, but you have to make sure that it's properly reviewed by the expert panel and expert groups to ensure that the vaccines are safe and efficacious and so forth. So they're in that process, and once they receive the final approval, then they would distribute it to the different countries.
Okay, thank you, sir. Today we're joined by Isanella Pato. She's from the newsroom. She has some questions for you, Minister.
All right. Thank you for having me. You mentioned that since last month you would have sent 10 samples to Carter to test for the new variant circulating. Can you explain why is it taking so long to get back the results?
Gene sequencing is a very complicated process. So I guess CARFA need time to be able to do the sequencing. Really, we're not sure. We have sent it and we are waiting the results. So we have done our part in terms of sending the samples. When you finish the sequencing also, you have to be able to interpret the sequencing that you have done. And that also requires some time to do. So it's a very complicated test that they're running, because this thing has 30,000 nucleotides that you have to look at, and you have to see whether any one of them have been misplaced and where that took place, if it did. So.
Any update on sending samples to the CDC in the United States to test for the variant?
Not as yet. We're still working out those arrangements through PAHO WHO.
Okay. Can you say why there is only 2 accredited labs to do PCR testing in Guyana? But for example, the Sheriff Medical Center, they have been doing PCR testing. What is happening there? And does the ministry include their results in the daily updates?
There are only, and I repeat for emphasis, there are only 2 laboratories that have been accredited by the Ministry of Health, which is the authority to accredit laboratories in Guyana. There are only 2 that have met that standard, and that is the National Public Health Reference Lab and the Eureka Medical Laboratories. Any other laboratory in Guyana who purports to be doing PCR testing is not in compliance with the directives of the ministry.
The question is, what is the current criteria for testing now? Is it random testing like in a marketplace?
But let me explain what's the process. We have a number of testing sites across this country run by the public service. And at those sites, any person can come into the site and they can ask to be tested. In some cases, what we would do is to review the person's history, and if they're symptomatic, then we can use one test. If they're asymptomatic, then we use another type of test. So that is available to the general public. And we have set up these sites to ensure that we can get a better understanding of what is happening with the disease.
Okay, you also mentioned that you're in discussions with a number of companies to acquire more vaccines. Can you be more specific to say what are some of these companies?
What?
What are some of the companies you're in discussion with to acquire more vaccines?
At this point, no.
Okay. Can you also say if you will be willing to take the COVID-19 vaccine?
Of course, I'll do it at the appropriate time, but if you have been following what we have put out, we have clearly said that there is an allocation schedule that we're working with, and that allocation schedule would be for frontline health workers to receive the vaccines first, followed by those with comorbidities and those who are older, and then after that, then we go to the rest of the population. So that's how we will be deploying the vaccine.
Thank you, sir.
Well, that's it for today's COVID-19 update. We just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.